right. Okay guys, you asked for a 259 video, so here it is. We're gonna do a one-shot wonder. This is my daughter Josie. She has volunteered to help me. So here we go, from start to finish. First thing I'm gonna do is gather the supplies I need. So I'm gonna need a stethoscope because I'm gonna be listening. I'm gonna need a timepiece that has a second hand on it so that I can count respirations and I can get a pulse rate. From that, I'm gonna need a tongue depressor so that when I go in the mouth, I can look at the oral mucosa, I can check the lips, the gums, the teeth, and the throat. I'm gonna need some hand sanitizer to do some hand hygiene. All right, so for the purposes of this video, I'm gonna go over the three main OSCE areas that you guys are gonna have. So I'm gonna do cardiac, I'm gonna do respiratory, and I'm gonna do GI, okay? If you have questions about the other systems, we can definitely meet online and discuss those, or I can give you some ideas on how to get those in, okay? All right, so let's get started. So first thing I'm gonna do is do my hand hygiene, and I'm gonna go in and introduce myself to my patient. So, morning Josie.
Hi.
My name's Connie. I'm gonna be your nurse today. I am here to do a physical assessment on you, which is gonna include me inspecting, palpating, which is touching, and then listening with my stethoscope. Is that gonna be okay?
Yep.
All right. So now that I have her permission, I'm gonna go ahead and I'm gonna start with Josie sitting up. So the first thing that I'm doing is I'm looking at Josie's face, and I'm looking for any signs of cyanosis around her mouth. I'm gonna do it from head to toe, including those three systems. So I'm looking for any blueness around her mouth. I'm looking for any nasal flaring that would show that she's out of breath, some different things. And as I'm looking at Josie's face, I'm gonna ask her a few questions. So I'm gonna get my health history questions out of the way. So Josie, can you tell me where we are today?
At home,
Do you know the date?
April 2nd.
All right. Do you ever have any difficulty breathing or a cough?
No.
No. Do you ever have any chest pain?
No.
Swelling in your ankles?
No.
No. Do you ever have an upset tummy? So nausea, trouble with your bowel movements?
No.
Anything like that? No. All right. So those are the health history questions. We're just going to get those out of the way. And then I'm going to describe what I'm doing, and then I'll do it. All right? Okay. So I'm looking at the mouth, and I don't see any blueness around. I see her lips are nice and moist. They're not dry. They're not cracked. There's no signs of dehydration. I would put gloves on. That's another thing you guys are going to need. So I did hand hygiene. I'm going to put my gloves on and get my clean tongue depressor. I'm going to get Josie to just say, ah. If you have a pen light, this is great too. And I'm looking at everything in her mouth. So I'm looking at her tongue. I'm making sure it's not coated. I'm looking at the teeth for any signs of decay. I'm looking at the gums. So I'm going to use the tongue depressor to push up and just get in there to see if the gums look healthy. They should be pink. They should be moist. Her buccal mucosa is nice and pink and moist. I'm going to get you to lift your tongue up. There's nice vasculature underneath the tongue and it's moist. And put it down. Say, ah. I can see her uvula. It rises on phonation. She has a nice pink back of her throat, and everything looks nice and moist and pink for the mucosa. So that looks really good, Josie. I'm just gonna feel her throat. It's nice and midline. And while I'm here, I'm just gonna pinch and check her turgor. All right, so now that I'm on the chest, I am gonna move into assessing what needs to be assessed for both respiratory and cardiac while I'm on the chest. So the first thing I want to do is look. So I'm looking at her chest. I don't see any obvious masses, bumps, lumps. There's no lesions, there's no bruising, there's no rashes noted to her chest. Her chest expansion from the front looks good, but I'm going to check it at the back with my hands. I'm just going to palpate now, Josie. So I'm feeling for any thrills or heaves. So thrills would be vibrations that aren't normal, and heaves would be lifting, okay, on the chest. And I don't feel anything like that as I'm feeling. All right, so now I've inspected, I've palpated, I'm gonna go ahead and auscultate her chest. So I wanna describe what I'm gonna do before I do it. So when I'm listening for her respiratory, I'm gonna be listening to the upper and lower lobes. And so I know the way the lungs sit in the thoracic cage. The majority of the anterior chest is actually going to be upper lobe. So it's kind of like a diagonal line that cuts down. And on this right lobe, there's going to be a little sliver of pie here that's going to be her mid lobe. Her lower lobe is actually going to be out here on the outside under her armpit. Same with on this left side. It's going to be out here is going to be her lower. This whole piece is going to be upper lobe when we're looking at the anterior chest. Posterior is going to be the opposite. We're going to have a small sliver of upper lobe, and then it's going to be all lower lobe. And the right side, we're going to see that mid lobe kind of in the axilla area. Okay, so landmarking, I'm going to listen right above the clavicle, and that's going to be listening in that upper lobe, right at the apex of the lung. I'm going to come down and I'm going to go into her second or even third intercostal space, still listening in the upper, and I'm going to listen right and left for a full inspiration, full expiration. Then I'm going to come down to that sixth intercostal space, and I'm listening to those lower lobes, and I'm going to kind of round out here to the sides so that I can get a listen. I'm going to listen for a full inspiration and a full expiration, and I'm listening for any adventitious sounds. All right, so Josie, I'm going to get you to breathe in and then out. If you feel dizzy at all throughout this, just let me know, okay? And then on a real client, I would obviously go under the clothing, but for today I'm not. Good, and I don't hear any adventitious breath sounds. So now when I'm listening for cardiac sounds, I want to listen to the 4 areas that we need to listen to. So I'm going to come to that second intercostal space, and on her right-hand side, this is going to be her aortic area. Then I'm going to listen in the second intercostal space to the pulmonic area. I'm going to count my way down to the 5th intercostal space, and that's going to be her tricuspid valve. Then I'm going to come mid-clavicular line, also in that 5th intercostal space, knowing it angles down, and that's going to be her bicuspid or her mitral valve. All right, so I'm going to listen. I'm really listening for S1 and S2, so that nice lub-dub. I'm listening for a rhythm, so is it a nice even tempo or a regular rhythm? And then I'll use her radial pulse to actually count to get a rate. But I'm going to listen to the quality as I listen here. So I'm just going to take a listen. Okay, Jill? All right, and she's got a nice, even, regular rhythm to her heartbeat. I don't hear any kind of extra sounds, no S3s, no S4s, just a nice lub and a nice dub throughout the entire chest. Obviously, on a real patient, we're gonna listen under clothing, and we're gonna lift the breasts up so that we're getting right against the chest wall, okay? All right, Josie, I'm gonna move down your hands now. So I'm moving down, I'm looking at Josie's hands. I'm looking for any signs of edema. I'm gonna check her cap refill, and we want it to be less than 2 seconds, which hers is. Her hands are nice and warm, good blood flow. I'm also looking at her fingernails for any clubbing or any signs, ridges, dents, white spots, anything like that on her fingernails. So while I have her here, I'm just gonna check a radial pulse, and this is where my timepiece with the second hand is gonna come in. So I'm gonna check her radial pulse for 30 seconds and times it by 2, just like you did in your vital signs OSCE. While I'm doing that, I'm also gonna assess her respirations. All right. So for the purposes of this video, I'm not gonna actually do it for the full 30 seconds, but I would want her pulse to be somewhere between 60 and 100 beats. I would want her respirations to be somewhere between 12 and 20 breaths, and I would wanna be able to describe that. So rate, again, is a number, so her pulse is between 60 and 100 beats per minute. Her pulses are equal bilaterally. It's a nice regular rhythm, and it's a nice 2+. She's not weak and thready, she's not bounding. Her breaths were between 12 and 20 breaths per minute, and they were a nice regular rhythm, and they were nice deep breaths. She wasn't breathing shallow, she wasn't apneic, it wasn't irregular at all. All right, I'm gonna just come back up to the neck and checking one side at a time. I'm gonna check that carotid pulse, and I'm checking it for rhythm and quality. So it's nice regular tempo, and it's a nice 2+ there as well. And this side is also nice regular tempo with a nice 2+. We never check them at the same time because we don't want to occlude them. All right. So I've done kind of her torso now. I'm gonna wait to do her abdomen and her GI assessment when we lay her down. So for right now, what I would normally do is just go to the back of the bed and listen to Josie's back. But because you guys won't be able to see, I'm just gonna get her to turn around on the couch. You guys in your OSCEs will just go around the bed at this point to minimize your client's movement. All right, so now I'm looking at the posterior back, and I'm doing my respiratory assessment on the posterior back. So I'm looking to see that the scapula are nice, they're centered on each side, on each hemisphere of the back. The spine is running down the middle. Everything looks good at the back. I'm gonna check her for symmetrical expansion. So what I'm gonna do is come to that T8 or 9 area, just at the bottom of the rib cage. I'm gonna give a little pinch, and I'm gonna have her take a big breath in and out. And one more time, in and out. And my thumbs are going out properly. She has nice symmetrical chest expansion. So I'm just gonna take a quick listen to the 8 spots on her back. So again, describing those fields, this is gonna be her upper lobes. They're just slivers on the back side. And then this whole piece is going to be lower lobes. And on the right-hand side, kind of, if you can just move her arm, just this middle piece right here, there's just gonna be a little sliver of pie. That's gonna be that mid-lobe. So I wanna make sure I include that. So I'm gonna listen upper, and I'm making sure that I'm listening in the intercostal spaces and not over scapula, so never listening over bone. So upper, lower, that's gonna be my 1, 2, 3, 4, 5, 6, lower, 7, lower, 8, middle. And again, I would be under clothing. All right, I'm gonna listen for a full inspiration and a full expiration. So Josie, I'm gonna get you to just take big breaths in and out. If you get dizzy, let me know. So lower, middle. And again, this would happen under clothing. So I've listened to my 8 posterior spots. I don't hear any adventitious sounds. There's nice clear air entry all the way for inspiration and all the way for that expiration. You can go ahead and turn back around, Joe. Thank you. And so I would just come back around the bed. We wouldn't have her move at this point. So I'm just gonna go back to her hands. I'm gonna have her do a bilateral grip strength. That's gonna be part of, go ahead and squeeze as hard as you can. Good. That's gonna be part of if you have your neuro. Also, if you had integumentary, you would be checking the skin all the way along. You could decide if you wanted to one of your joints at this point while they're sitting, or you could wait until you get them up to do their gait. It's totally up to you. So Joe, I'm gonna get you to lay down just to finish your gastrointestinal assessment, and I'll get you to just pull your shirt up just a pinch and your bottoms down just a little bit. So remembering when we're doing our GI assessment, we are inspecting first. So I'm looking at the abdomen, I'm looking for its contour, its symmetry, I'm looking for any lesions, any bruising, any masses, any pulsation. So a pulsation rate in the center here is normal. That's that descending aorta, and you're gonna see it on thin females. I'm looking to make sure she has an umbilicus and that it's midline and that there's no herniations or anything like that around her umbilicus. So I've looked, I'm gonna listen now, which is a little different order than the others. And I'm listening in the 4 quadrants for her bowel sound. So I would split her abdomen right through the umbilicus this way and this way. This would be her lower right quadrant, upper right, upper left, lower left. We follow it around the way the bowel would go, okay? So I'm gonna start in that lower right, and I'm gonna listen for her bowel sounds. Upper. So she has active bowel sounds in all 4 quadrants. Now bowel sounds can be a little tricky. In order to determine that there's no bowel sound, you'd have to listen for a total of 5 minutes. It's a very long time. And if you're hearing a ton and it's just bubbling away, those would be hypoactive bowel sounds. Josie had just normal active bowel sounds. So now that I've listened, I'm gonna go ahead and palpate, and I'm gonna ask her if she feels any tenderness. I'm also looking for any masses or to see if she's guarding while I'm doing this. And I want the same thing, do it in a rhythmic pattern, starting at the bottom and working my way to the top. So you let me know if this hurts at all, okay, Joe? And we want to roll a large area over to see. So she giggled there, which gave me a little bit of guarding. Josie doesn't love to be touched, and that's okay. So did you have any pain with any of that? No. So there was no pain. I don't feel any masses. Everything feels symmetrical. There was no guarding. So everything felt good. All right, so this is where I would check the skin also on her legs while I have her laying down. You could do range of motion with a hip joint and check for that bilateral muscle. And then I would come down here and I'm gonna check her pedal pulses. While I'm checking her pedal pulses, I'm checking to make sure that they're equal bilateral. Do they have a nice even rhythm? And what's their quality like? So her feet are a little cold, but they're still a nice 2+, nice even rhythm to those. I'm gonna get you to push on my hands, okay, and pull. That would be part of your neuro. And you're looking for equal strength. I'm also looking for edema from her cardiac assessment there. All right, I'll go ahead and help you sit up, Josie. Once you've touched their feet, you probably want to come back in, wash your hands. And this is where you guys could add whatever it is that you think you may have forgotten, or thank the patient. So thank you, Josie, for letting me do an assessment on you for my students. And you're done. All right, thanks guys.